Hello, this is Ramesh, Assistant Professor from the Department of Psychology. Today we are going to see about why assessment is used and broad purpose of an assessment. Now we will understand why psychological assessment is actually used in real life. First, assessment provides an objective information about a person's functions. Objective means it is based on facts and data, not a person's opinion or a guesswork. Through assessment, psychological gets test score, rating, structured observation, these are standardized. So they can be compared across individuals. The next one is assessment supports important decision in many fields such as clinical diagnosis, educational placement, job selection, and legal judgment. Assessment helps behavior and ability that are not directly visible. For example, memory capacity, a person's personality trait, attention problems. These cannot be accurately understood without a scientific assessment tools. Broad purpose of an assessment. It helps us to explain behavior, not just about labeling it. For example, instead of saying a child is poor in studying, assessment helps us to understand why. Is it attention deficiency or poor teaching, or is it emotional stress? Assessment also identify strength, what the person is good at, areas need to support, where help is required to the child. This balanced view is very important. Finally, assessment provides clear evidence for a planning intervention. Based on the assumption result, professional can decide what kind of help is needed, how much support is required, which method will work for them. In clinical psychology, assessment is mainly used for diagnosis. First, it is differential diagnosis. Many disorders have similar symptoms, for example, depression and bipolar, and anxiety and OCD. Assessment tools helps clinical differentiation clearly between such conditions. Assessment helps us to understand the severity of the symptoms, impact on the daily functioning. This helps us to decide the priority of treatment of an individual. The third, assessment support diagnostic formulations where test result, case history, observations are combined to form a complete clinical picture about the actual problem that the individual is facing. Assessment is not only for diagnosis, it is also essential for treatment planning. First, it will helps to match the right intervention to the problem. For example, CBT for anxieties, and skill training for executive function deficiencies. Second, assessment guide the intensity and the type of care that an individual needs, like individual therapy, group therapy, and medication referrals. Assessment provide baseline scores. These scores help used later to measure the progress of the therapy, evaluate improvement of the therapy, modify treatment if it is needed. Thus, assessment ensure effective and target of the treatment. In educational use, in education, assessment plays a very important role. Firstly, it helps to identify learning disabilities, cognitive strength and weakness of the students. This helps us to determine whether academic problems are due to learning disabilities, poor instructions, general cognitive disabilities, and assessment informs academic placement, curriculum planning for the individual students. Assessment helps us to design appropriate accommodations such as extra time for the individual, assertive techniques, modifying the instructions. These ensure equal learning opportunities for the for the students. School-based application. In school, assessment begin even before the formal education is started. First, school readiness assumptions. This helps determine whether the child is emotionally ready, social ready, and the student is cognitively ready for the educations. Second, the progress monitor and the response intervention. Short form is RTI. Short assessment are repeatedly conducted to track the improvement of the child. The third, assessment helps us to determine the eligibility for a special service such as individualized educational program. In short form, it is called as IEP. Thus, assessment support exclusive and inclusive support for an individual. Applications in career and vocational setting. In vocational psychology, assessment helps individual to choose suitable career for them. First, aptitude and interest test measures the ability, preference, work values, and so on. Second, assessment helps in career decision making by showing realistic option based on the ability and interest of the individual. Assessment identifies training needs, helping individuals plans like skill development, vocational training, career growth, and so on, whether the individual is actually needed. Industrial and organization application, in short, I&O. Assessment provide workplace effectiveness. First, in selection and recruitment process. Valid test improves higher accuracy and reduce turnovers for the company. Second, assessment help to identify leadership potentials, development needs, and the third will be assessment supports performance appraisal, training and career development for their employees. Thus, assessment benefits both employees and an organization to reduce cost and improve the turnover of the company. That's all for today's class. Today we seen about why assessment is used and where assessment is used in different settings like educational settings, clinical settings, I&O and vocational settings. This will help you to get a better view about what assessment used in different spaces and different workspace or in different settings. Thank you all.